So this is my next video on pregnancy week by week, in which I will tell you about pregnancy week 29, 30, 31 and 32. That is, I will explain to you in detail about your 7th month of pregnancy, what changes are taking place in your body. Is your baby developing inside? What tips do you have to follow so that you do not face any problem in pregnancy? So let's start now with the 29th week of pregnancy. In the 29th week of pregnancy, your baby becomes around 40 centimeters long. Plus his weight increases a little more than 1 kilogram. You can expect his weight to be around 1.25 kilograms. In the peak of pregnancy at 29, the baby's tendency to smile, the feature develops now. So your baby is capable of smiling inside. And he can smile especially while sleeping. In the last video I told you that the baby has a tendency to get hiccups, so by this week, till the 29th week of pregnancy, those hiccups can become stronger, and we can also feel the baby's movements. We can feel them more clearly. By this time we advise mothers to keep count of the baby's movements. But sometimes if the baby's weight is more or the fat deposition is good in the baby's body, then the movements do not feel so sharp, they feel a little gentle. Earlier mothers used to feel very hard kicks. Suppose in the 6th month of pregnancy, it is exactly as if the baby is kicking. But by this time, because the fat deposition has already happened, the body parts of the baby have become smooth, they have become soft, so they do not feel very sharply. Movements are felt, but you feel them a little gently. As I said, fat deposition is increasing in the baby's body, so from now till the delivery in the next weeks, the baby's weight almost doubles or triples. Fat deposition is necessary for the baby's temperature regulation, so this is a continuous process and it continues till the time of delivery. So as the fat deposition happens, the skin in the baby's body stretches out and the wrinkles and the wrinkling appearance disappears, so the baby's skin gets a smoother appearance. So this is about what all is there in the baby's body changes happen. So what can mothers expect in the 29th week of pregnancy? As I explained in my previous video, swelling in the legs is a common thing. By this time, you may develop spider veins or varicose veins. Or, then there can be simple pectoral edema, that is, swelling in the legs without any swelling of veins. For that, you have to massage the legs at night while sleeping. Whenever you get time, keep the legs in a slightly elevated position. You can also keep them elevated while sleeping at night so that whatever swelling develops day by day, it gets cleared on the same day. Along with this, you can have constipation, heartburn, indigestion, piles, bleeding from the gums, etc. So, my tip for the 29th week of pregnancy is, that is, keep in mind that the baby moves while lying on your side. You should feel the baby movements at least 10 times daily. Apart from this, for swelling in your legs, you should sleep by elevating your legs or keeping them in an elevated position. Be careful while eating and drinking. You need to maintain a balanced diet, take care of drinking water, consume less oil and spices as they can cause acidity. To avoid constipation, you need to take a rich fiber diet. You can include salads, you can include fruits, you should include things like porridge in your diet. You should have at least 1 plate of these things in a day. Apart from this, at this time you can decide the hospital where you want to get your delivery done. So let's talk about the changes that happen in the baby in the 30th week of pregnancy. By the time the baby reaches the 30th week of pregnancy, its length becomes about 41 to 42 centimeters. Its weight increases by another 200 to 250 grams. The baby's brain is constantly developing, increasing in size, so folds develop in the brain, so that it can grow bigger and bigger and can keep the capacity. That is why folds start developing in the brain. At this time, your baby's hands are fully developed, so you can see gripping movements. On sonography, the baby can hold his body parts with his hands. He can be seen holding the legs. On scanning, 30th week of pregnancy, now the thin hairs of your baby start reducing. The baby hairs, the light hairs start reducing, plus, the circulatory system, the nervous system of your baby is developing more. Now his bone marrow is overtaking the spleen and liver for blood cells formation. Now the blood cells of the baby, such as red blood cells and white blood cells, start getting produced inside the bone marrow. So this was about the changes inside the baby. Now let's talk about the changes that can happen in your body in the 30th week of pregnancy. Your baby has grown up now, and if you have not taken proper care of your skin and have not moisturized it, then stretch marks can appear even on the upper part of your stomach. you may get stretch marks during pregnancy. Initial symptoms like heartburn, acidity, frequent urination, all these things start happening again. By this time constipation is a common thing. Swelling in your legs can increase if you are not taking care of that thing, so my tip in 30 weeks of pregnancy is that you should try to change your position a little bit whenever you sit. A common problem that females, pregnant women tell, is that they start having pain in the lower part of the chest, so those muscles in the middle are under pressure in a way. The stomach is getting bigger from below and from above. The breasts also start becoming heavy, so there can be pain in those middle muscles, so for that you have to sit straight and do deep breathing exercises, so that is the position. Most of the time that thing gets cured, plus you deep breathing exercises should be done so that you can get relief from all the breathless breathing problems that you face at this time. You can take care of the swelling in your feet. As I mentioned earlier, your doctors advise you to get a sonography and a color Doppler done by the 30th week. If that has not happened yet, then you have to get it done. Apart from this, you have to take care of your posture. The shoes or sandals you wear should be of soft sole. While getting up, turning, or while standing up from sitting, you have to keep your movements swift and smooth. So, these are all small tips that will help you to overcome the small problems of your daily life. So, this was about 29 and 30 weeks. We know what changes happen in your baby by the time you reach 31 weeks, so your baby weighs around 1.5 kilograms now. The brain is developing, and the connections in the brain are getting stronger, and the brain's control over other body parts is getting stronger. Now your baby's sleep cycle is developing better, your baby's sensory organs have become better, and now your baby can use all the 5 sensory organs, which are ear, nose, tongue, eyes, and touch. In sonography, we can see that the baby's feet can do pedaling movements. The baby sucks his thumb, and there are many other things which now happen in a grown-up baby. By this time, the baby can use all these things your body develops.
The baby sucks his thumb, and there are many other things which now happen in a grown-up baby. By this time, the baby can use all these things your body develops. What changes do you expect in your body in 31 weeks of pregnancy? The first of them is increased frequency of urine, backache, swelling in legs, constipation, heartburn, difficulty in sleeping. Now you do not sleep so well.
Also have trouble
sleep
breathing.
breaks on turning
So this is
sides
my
or
tip
changing
for 31
positions
weeks
again
of
and again.
pregnancy. As I
Sometimes
told
you may
earlier,
have headache.
in the last
You
2
may
weeks you have to take care of the
also
swelling
have
in your
trouble
legs.
breathing.
Take
So
care
this
of the
is my
movements
tip
of the
for
child.
31 weeks of pregnancy.
Turn on the
As I
opposite
told
side.
earlier,
If you
in the
feel
last
less
2
movement,
weeks you have
then
to
you
take
have to
care of the
consult your
swelling in
doctor
your legs.
immediately.
Take
If
care
you
of
have
the
not done
movements of the
sonography
child.
and Doppler yet, then
Turn
you
on
have
the
to get it
opposite
done.
side.
You have
If
to
you
make
feel
some
less
postural
movement,
changes.
then you have to consult your
For
doctor
your backache,
immediately.
you have
If you
to
have
use
not
hot
done
water
sonography
bags.
and Doppler
And if you
yet,
have trouble
then
breathing,
you have to get
then
it
you
done.
have to do
You
deep
have to
breathing
make some
exercises.
postural changes.
So friends, this was
For
for
your
29,
backache, you
30,
have to use
31
hot water
weeks.
bags.
Now
And if
in
you have
32
trouble
weeks, our
breathing,
baby's
then you
length
have to do
becomes
deep
around
breathing
43 centimeters,
exercises.
44
So friends,
centimeters,
this was for
and his weight
29,
becomes
30,
more than 1
31
kilogram.
weeks.
Now at this time the
Now in
internal organs of
32
the baby
weeks our
are
baby's
almost fully
length
developed.
becomes around
And if
43
for some reason there
centimeters,
is a
44
preterm delivery,
centimeters,
then our baby
and
can
his weight
survive.
becomes more
The
than
only
1
problem
kilogram.
is that his lungs are
Now
not
at this
mature
time
yet.
the internal organs of the
The
baby are
surfactant
almost
which should
fully
be
developed.
formed in him is not
And if
formed
for some
completely
reason
yet.
there is a
That is
preterm
why if there
delivery,
is a
then our
preterm
baby can
delivery,
survive.
then the baby
The
can
only
have
problem
breathing
is that his
problems,
lungs are
for
not
which the
mature
doctor
yet.
has to start injections
The
of surfactant
surfactant
or
which
some
should be
medicines
formed
from
in him
outside.
is not formed
Apart from
completely
that,
yet.
all his
That is
internal
why if
organs
there is a
apart from
preterm
lungs are
delivery,
fully developed
then the
now,
baby can have
and that
breathing
delivery you can
problems,
survive
for which
after.
the doctor
Your
has
baby
to
is
start
still trying
injections of
inside.
surfactant or
Breathing
some medicines
practices
from
are happening,
outside.
so that he can
Apart from
prepare
that,
himself
all his
after
internal
delivery.
organs apart
If
from lungs are fully
there is a
developed
sudden
now,
delivery,
and that
he
delivery
can
you
try
can
to breathe
survive
out
after.
or breathe
Your
in.
baby is still trying inside.
But still his lungs
Breathing
are not fully
practices are
mature.
happening,
Now
so
the
that he
skin
can
of the
prepare
baby
himself
becomes
after
completely
delivery.
okay.
If
First it is translucent,
there is a sudden
transparent,
delivery,
and then
he
the
can
skin
try to
is
breathe out
pinkish.
or breathe
But
in.
now by the time the baby reaches this time, the skin of the baby is fully developed and it becomes okay. By the time of 32 weeks, the movements of the baby are not proper rotatory movements. He is mostly able to fix his position. If the baby's head is down or legs are in down position, then mostly he remains stable in the same position. The chances of changing the position and rotating completely decrease now. So this was about the baby. Now let's talk about the changes that come in the mother's body at 32 weeks of pregnancy. Your baby is growing more and is expanding more upwards, so our rib cage has now reached that level. You may have leg cramps, constipation problem. You may have complaints of urine infection or frequent urination. Bleeding from gums or piles are all common because the blood flow is good. At this time there is confusion in the mucosa, so if you get hurt even a little, you may bleed. your skin due to stretching. There can be problems of itching in the stomach and breast, so for that you have to continuously apply moisturizer or cream, whatever your doctor suggests. So my tip for 32 Vicks is that the most important thing is to sleep on the left side and take care of the baby moving. If you have any doubt, contact your doctor immediately. You can start planning for your delivery. If you have not done it yet, then you can start shopping for the baby or preparing for his nursery in the 8th month. If you are not doing exercises yet, then you must start exercising at this time. Butterfly squats are exercises for the pelvic floor muscles. You should do them under some guided supervision, so that you get help in delivery. So friends, this was my video on 7th month of pregnancy, i.e. what changes happen in your body and your baby in week 29, 30, 31 and 32.